there are other platforms as well, right? Like Maven or Tia are doing the same thing. How do you differentiate yourself in that space?
Everybody needs software to be able to actually deliver that care. We have seen some amazing innovation in care delivery when it comes to things like menopause, fertility, pregnancy, postpartum. What we do is allow for all of that care to be run on a single platform. Project which I was working on with the WHO, we looked a lot at testing in pregnancy in rural areas and how that could be done more efficiently and at higher quality. So my background and my passion has always been in women's health and global public health.
What differences or what gaps did you see and that motivated you to start Aster?
Yeah, the gaps were really about timing, efficiency, follow-up and testing, things like that. So that's what we've built into Aster.
Yeah, I think this is very valid point. And I personally have faced the same thing. The doctors are in so much rush, I would say, that maybe because there are a lot of patients or they have a lot of admin work. So most of the times they are in their system, just putting on the details instead of talking to the patient.
So for us, that looks a lot like how long does it take you to document a typical prenatal encounter? So that is, if you were in a hospital setting, you may spend 30 minutes documenting and typing up the visit that you just had with a patient. In Aster, that's currently 16 minutes.
So as for McKinsey 2023, closing the women's health gap could really generate 1 trillion annually by 2040, right? Yet it is still viewed by many as niche investments.
Absolute goldmine opportunity though, because women are the decision makers when it comes to healthcare. So if you're able to capture the women's health market and you're able to speak to the mother, the sister, the grandmother of that family, you do actually give yourself an opportunity to care for the entire family.
Are you surprised to see the another fact which I will read out and which completely aligns to what you are saying? So 2% of all VC in digital health went to companies focusing on women's health. It's only 2%. Even though women make up to 50% of healthcare. This is surprising. We have seen the numbers, right? We have seen the facts. We have seen the interest from the people. So what are the challenges coming from development or finding out the use cases till, getting a product ready to sell?
Often we speak to investors who are super excited about the space, but maybe just don't quite have the understanding to know that our metrics may not be the same as a fast-growing AI company in fintech, for example. So just having that awareness is kind of key and can be a challenge sometimes.
The cycle of women's health, right? From a girl to a woman, say like 60, 70 years, there are different types of problems. So are you starting with pregnancy or are you starting with pre-pregnancy? What are the use cases you have been taken and you are planning to build more in the future?
So our platform is designed that you'll be able to take care of a woman throughout the whole life cycle.
So what's your moonshot for Aster for coming years?
I think for us, it's pretty clear. We would like for all of women's health to run through Aster. That's it. That's how simple it is.
One simple statement covers everyone. Thank you so much. And it looks very, very exciting. So do you have something which we can see?
Yeah, absolutely. I'd love to show a little bit of our labor and birth flow, something that often gets used when somebody is delivering out of hospital.